Katrina Parker is a dairy vet with a special interest in dairy herd preventative medicine. She's completed a number of studies examining the effect of administering teat seal to maiden heifers prior to calving. Katrina, a heifer with mastitis has got to be just terribly frustrating for any dairy farmer.
Yeah, definitely. I mean, the cost of getting a heifer to the cowshed is probably $2,500 for a farmer. And if she gets clinical mastitis on the first day coming into that cowshed, then we've got the cost of treatment, the cost of the time treating her, the frustration of treating her when she's a maiden heifer training to milk. You've got the cost of lost production for that lactation, the increased risk of being culled, the increased risk of high somatic cell count for later in lactation. So yeah, the frustration for farmers is huge, and time and money.
It's only relatively recently, though, that we've actually had an opportunity to help or prevent this problem, at least in a grass-based system.
No, in New Zealand and Australia, where we are primary grass-based, we haven't had a lot of information about why our heifers get clinical mastitis, particularly at the time of calving. Overseas, there has been work in the last 20 or 30 years, but a lot of it we don't know whether it's applicable to New Zealand. So yeah, it's only recently that we've actually started doing some research in the heifer mastitis area.
Tell me a little more about what your research actually involved.
Yeah, I'm one of a few of our research team that's been working to try and identify risk factors for mastitis in heifers. The work that I've done has been part of my master's through Massey University, which has been really fascinating, finding out some of the reasons why our heifers get mastitis and some of the things we can do to reduce it.
What kind of results did you get?
I mean, heifers at the time of calving, it's not just that the bacteria are there at the time of calving. Some of those bacteria are already in the heifer's quarter, and once she comes into milk, then it turns into clinical mastitis. So those are very frustrating if the bacteria is already up the quarter. At the time of calving, the amount of bacteria in those quarters increases just due to exposure of environmental bacteria in the environment, in the muck and in the mud, that get up into that quarter and then cause clinical mastitis in those heifers. Some of the things that increase the risk of that occurring are udder edema, so that's those heifers with really big swollen udders. That increases the risk of mastitis, and other things as well, like the size of a heifer. So if her teats are higher off the ground, she's at less risk of having bacteria up there, which sounds like common sense really. But yeah, so those things are the risks that we've identified. There's a lot of complex factors that we haven't quite figured out yet. Interactions between condition score and increased risk of infection. So there's obviously a lot more work that needs to be done, but yeah, some of them are definitely seemingly common sense. So now we identified some of the risk factors that cause mastitis in heifers. We could look at some of the things to try and decrease the risk of mastitis in heifers at calving. And one of the products that I trialled as part of my master's was looking at infusing the quarters of heifers with teat seal, which is a product which is basically almost like a glue that we put up the quarter to stop bacteria getting in. So it's a physical barrier to prevent new infections coming into that quarter. And we did a pilot study back in 2003 looking at whether the concept works, because it was a very novel concept. No one had ever done it before. And we found that yes, there was definitely a good effect. There was a reduction in clinical mastitis in the heifers, or the quarters of the heifers that we treated with the teat seal. So then we went on to do a more wide-scale large herd field study where there was 30 herds involved and over 1,000 heifers, so it was definitely a big study, looking at using the teat seal in those heifers 4 to 6 weeks pre-calving, putting the teat seal up and looking at whether we reduced mastitis at calving and over the first 2 weeks after calving.
And what were the results?
The results were amazing. Basically we got a reduction in subclinical mastitis, so that's infections that are present at calving but not actually causing clinical signs, a reduction of around 65% in all bacteria. Now in New Zealand, the most common cause of mastitis in heifers is Streptococcus uberis, which is an environmental bacteria, and the reduction in infections with Streptococcus uberis were about 75%, so extreme reductions in subclinical mastitis in calving, around calving. The mastitis, clinical mastitis, the reduction was around 50%. So extremely impressive results in regards to reducing mastitis around calving for the heifers.
What do those results tell us about how we can better manage mastitis in a maiden heifer?
Well, that's exactly what we thought when we first started doing the trial work, is how on earth are we going to insert teat seal into maiden heifers that have never been into a cowshed before. But surprisingly, they actually tolerate it extremely well. So the way we go about it is, as I said, about 4 to 6 weeks before the planned start of calving for a group of heifers, we go in and treat these heifers. It's ideal if the heifers have been trained to come through the shed. So if it's a herringbone shed, they've been trained to run through the herringbone shed. If it's a rotary shed, a little bit more difficult because they've got a bit more room. So obviously they're not nicely packed in. But if they've been trained on the rotary, that's really useful as well, just because they're more quiet and more comfortable in their environment. So basically, if they've run through the shed a few times, then what we try and do is pack a small number of heifers into the side of a herringbone, and basically that keeps them jammed in nice and tightly, and then they won't move, and they won't get too stressed because they've got their friends with them, and basically it's reasonably easy to apply. So what we do, if we've got a technician or a vet that's inserting the teat seal, often you'll have a farmer or a farm staff worker hold the tail out of the way, so obviously to decrease the risk of getting cow muck and mud onto your hands when you're inserting. And we do it in a very similar fashion to the way we apply dry cow therapy, or we teach our farmers to apply dry cow therapy. So hygiene is extremely important because obviously these teat ends have never had anything up there. They are functionally clean, so we don't want to be taking any bacteria up there. So hygiene is extremely important. And so what we do is we clean the teat ends and then go around and infuse. And after infusing, teat spray them. So it's actually not too complicated to do.
What would you say to a farmer who says it's going to take me too much time?
It is time consuming, and you have to be prepared to spend the time 4 to 6 weeks pre-calving doing this job properly, and then reap the benefits when the cows start calving, because you're getting less mastitis in your heifers. And in the middle of spring, when you're stressed and busy, you don't have time, you're getting less mastitis. So it's spend some time at the beginning to reap rewards at the end. The financial rewards dependent on the cost of a case of clinical mastitis in heifers. So it's really interesting. The motivations of some farmers to use the teat seal as a preventative are different to others. Some, if they get 1 or 2 clinical mastitis cases in their heifers, that's enough to want to teat seal the mob, because they hate heifers with mastitis because of the costs we discussed earlier. Some farmers, they need the financial motivation. So when the number of clinical mastitis cases in their heifers gets to 15 or 20%, then they're looking for a way to reduce that from a financial point of view. So basically, you're reducing the number of clinicals by 50%. You're reducing the lost production, which isn't counted in the cost of a clinical case. And you're looking at keeping those heifers for longer in the herd. I mean, they're going to be in the herd for longer because they haven't had clinical mastitis early in lactation. So the cost benefits are huge.
What about the return on investment a farmer might expect from this?
At around 15% clinical mastitis in the heifers, you'll break even using the teat seal as a preventative.
And what's behind those calculations?
Basically, when I've